Hey, this is Brandon, and we're now working with our SOT in our category 3. And our first step here is going to be we're going to check the SOS to see which side is going to be the short side. So I'm going to deify the patient, make sure that there's no belts on, no watches, anything like that. So we can take the patient's hands, grab it just still approximate to the wrist. See your fingers, sir. Hands together, not looking, together and check. Okay. Looks like our right side is our short side here. So what we're going to do is we're going to stand on the contralateral side. Have the patient raise the right leg here. What we're going to do is we're going to follow the top of your leg, Chris. Come over just medially, and then we'll feel right there where the SOS is. Okay. So as I breathe in, we're going to push the patient's knee out. We're going to hold. We're going to apply some pressure. As it breathes out, bring the knee in. Repeat the process again. Breathe in, push down, breathe it back in. Good. One last time. All right. Good job. So now we will reassess the SOS. Patient's hand again. See your fingers. Okay. Now they're even. If they were not, we would just redo it until it was even. Okay. So I'm going to have the patient flip face down. The next step is going to be our leg length analysis. So what we're doing here is we're checking for the most superior medial malleolus as our landmark. Take the patient's legs. You're going to compress outwardly. Good, relax. So checking the medial malleolus. This right side is going to be the high side, so we're going to make a note of that for our future. Okay? Now moving on into our glute fiber analysis. We're going to start medially at spot number 5 and move outwardly to spot number 1. And each location is going to be indicate which lumbar we could have a complication with. So start at the PSIs. Okay. Off to the side there. Check the other side. Okay. So was there any pain or tenderness? So you had pain on this right side here. Number 4. And he says on the 4th one. So it's going to be that's tender right there. Okay, so that's going to correlate to lumbar, our 4th lumbar. With the Lover Brothers, that's going to be correlated to our C2. So what I'll do is come over here to the C2. Find where that's at. Okay. And check the tenderness on the spine process of C2. Is there any tenderness there? A little bit. A little bit. Let's check on the TVPs on each side. Tenderness? Tenderness? Not really. Okay, so the spine process is the most tender spot there. Okay, that's going to. We're going to make a note of that so that when we move into our blocking, we can identify what our complication is at L4. The next step is going to be by finding tenderness within our calves, both sides, and at that point, just hamstrings, glute, following your temporal spinal line. Do you have any tenderness in any of those spots? In the thigh, this side? Okay. We're going to make a note of that. Do the same thing on the other side with the calf. Still looking for tenderness here. Again. Temporal spinal line right here. Any tenderness on these sides? Calf and the thigh on the side. So we're going to make a note of that. So after we complete our blocking, we're going to be checking, see, and look for changes there. The last step we're going to do here is going to be our SOT, which is going to be, we're going to step out and rotate that leg out. We're going to check and see if we have herniation, sequestered disc, or peripheral syndrome. So I'm going to check the patient's, so I'm going to reach right above your patella here, okay? Here's patella. superior to that. Right on the thigh here. Okay. Another leg here. So what we're going to do is we're going to abduct the leg, looking for bunching and folding of the gluteal medius. At this point, we're going to rotate the hip, hold this for 15 seconds.
And then the director spine and lumbar spine as well. And the last point,
rotate back neutral, bring it together, set down. We're going to wait 2 minutes. So now that 2 minutes has passed, we're going to repeat the same process again. Down. Find the bunching. Gently rotate the hip. 15 seconds.
Slowly bring it out.
Rotate it back in. Bring it down. Now we'll ask the patient if there was any difference, any increased pain, decreased pain, or any difference during those two. So there's no difference, which indicates to me that there's a subluxation or herniated disc in that area. If there was increased pain as we perform the exercise, that's going to mean that we have a sequestered disc. If there was a decrease of pain, that's going to mean that we have piriformis complication. If there was decreased pain, you would perform the exercise until there was no more change in your pain. And that's going to conclude that.